I've never been prouder to be associated with the NHS or its staff. I've witnessed tremendous, compassionate, skillful, effective care given in the most challenging of circumstances. It makes me a little bit emotional. Really grateful to the staff, but extra grateful to the volunteers who've given tens of thousands of happy, smiling, cheerful hours to our programme. Really, really helped us out. Couldn't have done it without them. Thank you.
Because with COVID, we couldn't visit my dad in hospital either, and that was a worry, that I wouldn't be there to look after him, that he'd be there on his own.
I was treated straight away. They were excellent with me. I was taken through to a treatment room where they took blood, to get my temperature, and then they put me on the drips and the antibiotics, and I was there for quite a while. And then eventually they took me out of there and they put me in a corridor. Actually, when I left the house, I didn't have anything with me. I didn't have a phone, money, a watch, nothing. The only thing I had was my hearing aids.
Yeah.
Yeah.
I was so hopeful that he wouldn't go to hospital that we didn't pack a bag.
We didn't pack a bag. Yeah. I was led on the trolley in the corridor for a long, long time. And the paramedics that had actually fetched me into the hospital walked past. And for some reason, they recognised me. And they said to me, "Are you still here, Paul?" And I said, "Well, yeah, I am actually." And he said, "Good heavens." And they said, "Is there anything we can do for you?"
As I was walking down the corridor, I saw Paul on a trolley against the wall on oxygen. So we gave him a glass of water and then we left. And then on the next patient, we went back to him. And I think at every patient we went into hospital,
we
kept going to check on him because he hadn't moved from that corridor at all. He said that he'd not spoken to any of his family because his batteries in his hearing aid had gone. So then we went hunting for batteries. Yeah. You won't believe how hard it is to find batteries. So we went looking for batteries, and after that we got him some waters, so he didn't feel like he was bothering anybody by asking a member of staff if he could have a glass of water. So we got him a pack of waters, and so got some flavoured water as well. Yeah. And then he was adamant he didn't want anything to eat, but we got him some chocolates, meltable chocolates, so he wouldn't choke on it.
Later on in the evening, they actually came back again. Right, and they fetched a case of water, and they fetched a big bottle of flavoured water, and they fetched some chocolate and refreshments, so I wouldn't have to bother anybody.
And it was so lovely to hear that two people, these paramedics that brought him in, went and checked on him, and brought him things, and I think they even noticed that you had a problem with your oxygen cylinder as well.
Yes, they did.
And so they were giving him care as well, and for them to actively go to him and see if he needed anything rather than him having to ask, I thought was just so lovely. I've never heard of anyone being that kind.
I've never seen somebody be so grateful for something that I class as someone just attending somebody's needs, just the little things in life. And it was nearly in tears, which really brought us to tears, wasn't it, the way he was.
To see Paul and Katie again today, it's nice. It was emotional, but like Newton said, he's back with his family, and more importantly, he's in good health.
So basically, how we came to meet each other and be in this cricket club, we got a brief to say that COVID vaccinations were being rolled out locally, and as a network and all the practices, did we want to become involved in that? That was it. It was just, yeah, we'll do it. Somehow we'll just set up a clinical setting here in the cricket club. The volunteers said that they would, from the cricket club, said that they would do everything to help us, and so we just decided to go with it.
We couldn't have done it without them, basically. We couldn't have done the programme without the cricket club volunteers. They manned the car park 12 hours a day for 6 months, and that bit of it we didn't have to worry about at all. Thanks to them, we couldn't have done it without them. It was a bit of an emotional time. Yeah, once a year.
Staff were scared.
Yeah. Everyone was.
Patients, they were looking for you to give them some sort of hope that there was going to be an end to it.
Yeah.
And we didn't have any answers. You know, I've never worked through an international pandemic before. I've never managed teams that are scared, who are shielding, you know, and patients are trusting you. That's the trust in you to give them some way out, and we couldn't do that if the cricket club hadn't have offered to open up for us and let us do it.
When we were asked as a club to support with the vaccination rollout, it was a very, very easy decision. It was, yes, how can we help? We felt that we had a real sense of duty as a club to support our local community.
I don't think you realise that over the 6 months, 25,000 people through here. It does take a lot of volunteers to make sure it runs smoothly, and helping out the NHS staff was fantastic because we all got on so well. You feel really proud to do it. It's, yeah, it's strange really. I don't think that if we can save so many thousand people by helping out getting injections for this COVID thing, it's just amazing. I'm just so thankful that we have the opportunity.
We came back a bit to meet the volunteers, didn't we? We presented them with a plaque and a bench, so hopefully in years to come, children and grandchildren will remember that, you know, what a pivotal part in the vaccination programme this building and all its members were.
The COVID pandemic has had a particular impact and given me, obviously, led to more concerns on my part about how my mum was. And quite honestly, had she been at home, God knows how we would have dealt with it, because she would have been on her own without visitors, etc., etc. But again, because of the quality of the care that's been given to us here at the home, it's taken away those concerns. And I haven't been able to visit her all the time, but the home has made provision so that we could come and have visits, but in a safe way.
I'm not comfortable with frail elderly clients sat at a door, covered in blankets, visiting, and relatives stood outside in the rain. So the cabin was born. We put a petition up so that they could sit knee to knee as close as they possibly could, but still without that physical touch and without air being able to get through. And we've managed visits that way for a long time. It's such a big responsibility looking after someone's relative, and then this on top of it, it's such a responsible thing, making sure that we've done the best that we possibly can to keep COVID out of our building and keep your relatives safe. It really has been a big responsibility.
So really, to finish, I need to thank Nadine and the whole of her staff for keeping my mum safe, happy and well, because their work and their efforts allow me to be relaxed and happy at home.
Everyone's got their own story of what's happened over the past couple of years with COVID-19. And it might be an emotive one, it might seem like a simple, straightforward one, but there's countless stories out there and examples of people going above and beyond to help our population and patients get through this. So whether we look at one or hundreds, we need to make sure that we're saying thank you to those staff, volunteers, and everyone else that was involved. So thank you.